Welcome to the Third Wave Podcast. I'm your host, Paul Austin, here to bring you cutting-edge interviews with leading scientists, entrepreneurs, and medical professionals who are exploring how we can integrate psychedelics in an intentional and responsible way for both healing and transformation. It is my honor and privilege to bring you these episodes as you get deeper and deeper into why these medicines are so critical to the future of humanity. So let's go and let's see what we can explore and learn together in this incredibly important time. Hey listeners, just want to let you know that we've opened up our next microdosing experience. It's Third Wave's flagship 6-week program that helps guide you through an intentional microdosing protocol to help you cultivate what we call the skill of microdosing, how you work with microdosing to heal, for performance, for greater clarity and cognition and energy. We have 2 coaches who will guide you through that. I will also be part of that. We also have a couple master classes, one with a yoga instructor who's going to teach about microdosing yoga. She also has her PhD in neuroscience, Tara Zinnemann. So yoga microdosing. We will also have a class on optimal wellness and performance from a medical doctor. And finally, we'll have a breathwork breakthrough ceremony. So that's a 6-week course, breathwork, 4 weeks of integration with microdosing. We just have a few spots left. If you're interested in joining, go to Third Wave's homepage, click on microdosing experience, or you can just reach out on social to us and we're happy to help get you enrolled. Thanks so much. And this podcast is sponsored by Mind Bloom. Legal psychedelic medicine is here, and it's available through Mind Bloom. Mind Bloom helps you transform your life with safe, science-backed psychedelic therapy. If you're looking for your depression or anxiety breakthrough, Mind Bloom provides a fully guided and clinician-monitored experience tailored just for you. Some clients see results as soon as 24 hours after their first session. Mind Bloom is, in fact, our first official partner here at Third Wave and a company and organization that we support. In fact, I'm going to start my own Mind Bloom experience in the coming weeks, and will write about my experience going through ketamine therapy to address both cannabis addiction and general anxiety. The cannabis was to cover up the anxiety, and I can't wait to share my own transformation with you. So, Third Wave Podcast listeners, you get $50 off your experience today if you use the promo code Third Wave is here. Reach your full potential at mindbloom.co. Hey listeners, and welcome back to a special edition of Third Wave's podcast in partnership with Microdose and our Psychedelic Insider series. Today we're interviewing Yaron Conforti, who is the CEO of Novamind, a mental health company that is enabling safe access to psychedelic medicine through a network of clinics, retreats, and clinical research sites. Yaron, welcome to today's podcast.
Thanks, Paul. Good to be here.
You know, before we get into sort of the nitty gritty of Novamind and the specifics of what you're up to, just sort of tell us about your introduction into the space, how you started to learn about psychedelic medicine, and just sort of the initial inertia behind Novamind, why you started Novamind. What's sort of the origin story of Novamind?
Yeah, I'd be happy to. It starts as a personal story and then became professional. You know, my own experiences with psychedelic go back to I'd say a couple decades now, and those experiences were mostly recreational. I mean, I'm not that old, but I grew up in my formative years in an era where stigma was obviously still there. Obviously, access to psychedelic compounds were restricted. And so it was really just a recreational context that I understood them, but I was always fascinated by those changed states of consciousness and really any non-ordinary states of consciousness and the ability to influence one's behavior. So, you know, those experiences were formative. Fast forward, and a couple of years ago, I started looking at the research very closely. I think it's the research that led to the re-emergence, or it's called the renaissance of the psychedelic sector. And I had the opportunity to have a couple of therapeutic experiences, again, very different from those recreational experiences. And they were profound. And around the same time, I began investing in the space. And fast forward 2 years, you know, we've built a leading company that's operating psychedelic clinics and clinical research sites.
Bring us a little bit deeper into the infrastructure that you're creating, what you currently have available with Novamind, because one thing that I love about your particular focus is, you're really looking at what can you do to provide safe and legal access to psychedelic medicine now. And that's really in significant comparison to many of the other companies, public companies in the psychedelic space, which are really looking at, 2, 3, 4, 5 years down the road, having psilocybin approved or MDMA approved. You're really looking at what's available now. How do we sort of enable access for this? So I just love if you could, fill our listeners in about what is it that you currently have going on with Novamind? What companies have you invested in, or what companies are you working with to ensure that safe and legal access to psychedelic medicine is more available?
Yeah, for sure. And I agree. I mean, that is where we objectively differentiate ourselves.
Mm-hmm.
There's obviously a lot of companies and there's a lot of capital flowing into the space. So you're using a bit of an ontology, and I'll give you the legacy for it. There was a thesis, really, that this all emanated from. I co-founded the company Novamind with two partners, Shirley Weinreb and Jesse Kaplan, and I've built a lot of businesses with them. So the thesis when we started this 2 years ago was, let's find the people in psychedelic medicine that are helping people today, and let's partner with those people and scale access. So that was the broad thesis. And that led us to, a couple of investments and a couple of partnerships. So from a macro view of let's help people today, let's find the people helping them and let's support them, that became a couple of investments and a couple of acquisitions. So we made a significant investment in the Synthesis Institute in the Netherlands, as an example. We made acquisitions in the U.S. of Cedar Psychiatry, which is a network of mental health clinics. And it's also a clinical research organization or contract research organization that provides infrastructure to support clinical trial work. And so it was through those acquisitions primarily, and in some cases investments. We made some other investments that I can mention as well briefly, but it was primarily through the acquisition of Cedar Psychiatry and Cedar Clinical Research where we were able to, in real time, develop, buy and build businesses that were treating people. So that brings the focus to ketamine, because in the United States, obviously ketamine is the first legal psychedelic. And the partner that we found in Cedar Psychiatry was founded by Dr. Reed Robison, and Reed is now the Chief Medical Officer of Novamind, has been involved in the space for many years, is a known thought leader. So to be specific about that, both as a clinician and in clinical research. Reed is one of the coordinating investigators for the MAPS Phase 3 MDMA clinical trial. He's also previously led the clinical trial in Utah for Spravato, which many of your listeners will probably be familiar with as the first ketamine prescription drug approved by the FDA. And so that breadth of experience, essentially enabled us to take a position in this industry where we already were entrenched. Last year, Cedar Psychiatry had over 20,000 client visits, just to give you an idea of scale. So from that platform, we're able to build much more quickly. And instead of reinventing or inventing from zero, both the infrastructure, the protocols, the teams of therapists, et cetera, that need to support that activity, we're replicating a model that already works, right? So hopefully that gave you an insight into how it went from thought to execution and where we are today. It was really about partnering with people, and that gave us the ability to grow, exponentially, because we're at 4 clinics now, and I think by end of year we'll at least double those clinics.
Are those clinics then particularly in the United States? Are you looking at all of North America? Are you also looking at Europe in terms of the clinics? We know Synthesis pre-COVID was doing retreats in the Netherlands as part of Network, and they may be moving to Oregon with some of the legalization there. But specific to the clinics that you're looking at opening, what sort of territorial focus are you taking with that?
Mm-hmm. All of the above in terms of what you listed. So we really are taking a global view. The investments that we made early in the Netherlands were, we invested in that jurisdiction for a reason. We did a lot of due diligence at the time, and we found that Synthesis, in fact, rated as one of the best, if not the best in the world, at providing that legal, medically supervised psilocybin experience, which compares to the quality and standard of care that we offer stateside. So to be clear, our clinics are currently based in Utah because Dr. Robison is based there, and that's where he founded them. From a Novamind perspective, a couple of the jurisdictions you mentioned, Paul, as an example, Oregon, we're following the policy moves very, very closely. And based on, a lot of people don't like to make analogies with cannabis in the psychedelic space, but from a policy perspective, I think it's fair to. And I think we're starting to see the momentum, as mentioned, in states like Oregon, as well on the East Coast. We can list a couple of the policy developments there, but it's a momentum and sort of snowball effect that one picks up after the other, and politicians and their constituents start making decisions that are going to positively affect, ultimately, which is our goal, right? Affect our ultimate goal, which is to enable access, that people should have access to these alternative therapies.
Currently, clinical sites that are in Utah, you said the Cedar Psychiatry has seen over 20,000 clients so far. Your current chief medical officer, Reed Robinson, has been involved with the MAPS trial. So you're clearly building an excellent professional team. Synthesis has facilitated retreats for, I think, over 600 folks, 650 folks at this point. You also have an investment in a place in Costa Rica, which I want to learn a little bit about more. And so I'm curious about sort of Novamind's approach in terms of the balance between public facing. So in other words, are you going to set up a sales and marketing infrastructure through Novamind to get people into Cedar Psychiatry and get people into Synthesis? Or are you simply supporting through investment on the back end and saying, hey, Cedar Psychiatry has its own sort of marketing channels and Synthesis has its own marketing channels, and Novamind is sort of the ecosystem on the back end, but you aren't near as public facing? What's the balance that you're taking as a company in that respect?
Gotcha. I think a couple of clarifications are really important. And it's a fair, I would say it's arguably easy to confuse because we do hold an investment portfolio. So Novamind, when it began, made a number of investments, and we still hold that investment portfolio. So I'll just speak to it now. Synthesis, we mentioned, is in that investment portfolio. We also invested in Field Trip, which is a clinic company and a peer of ours. We also invested in Circadia, which you mentioned is a retreat opportunity in Costa Rica. And we also invested in Atai, which many people are familiar with. And as shareholders, along with others, we're excited about what's expected to be I think a NASDAQ listing this year, or early this year. So that is a Novamind investment portfolio, is effectively a legacy. To be clear, that's a legacy portfolio. Because what we were doing, along with my partners, our model is generally to invest our own capital before we build a company. And we did that, and we learned a lot, and we continue to gain a lot from those partners and those relationships. But that, Paul, you and your listeners should view that investment portfolio as something that remains an asset on our balance sheet, but we will not be making any more passive investments. If we do make investments from the Novamind perspective, it's going to be very strategic, and it's because we are absolutely focused on our operating model and our operating model for psychedelic clinics and clinical research sites. I don't speak a lot about retreats today because of the COVID environment. We haven't been able to launch that part of our business, but you can view it as essentially clinics and retreats in terms of where people have access to these alternative mental health modalities and experiences, and then clinical research site, where the clinical research part is a very specific business plan and sort of thrust of Novamind. So now that we have a bit of an ontology, let's say, for what Novamind is and isn't, we are 100% focused on scaling our clinics and clinical research sites. There's a symbiotic relationship between the two, and I'll answer your question as it relates to how do you effectively market these channels, for lack of a better word, being clinic, where clients can access these experiences, and the clinical research sites, which serve a different client, which is a pharmaceutical company or an academic institution or not-for-profit institution that may be involved in the clinical phase drug development, and which we have the expertise to facilitate. So these are the two groups we're serving. And in terms of your question about how to market to them, the reality is that the environment we're in, such that mental health is so front and center, that COVID has, without a doubt, exacerbated the issue, and if certainly there's a benefit, destigmatized. And I think, Paul, I know you've been in the space for a long time, and anybody who's contributed any amount of time, particular to the mental health space, I hope is feeling that change, that softening on a real societal level, policy level, economic level, any level you want to look at. So obviously that plays into our favor. There's a business side to this. We built a platform here because we expect to help a lot of people with access to alternatives that they never had before. but we certainly want to build a profitable and sustainable business. And in that context, what's happening, I can tell you, is that the demand is immense. I mean, I'm not talking about, sharing headlines or pontificating with people on macro views. I'm telling you that as the CEO of a mental health company that operates 4 mental health clinics, I mentioned to you that 20,000 client visits, and that was in 2020, calendar 2020. That was double the client visits we had in 2019, right? We also put out a news release just actually today, where what we've been doing with some of these news releases is we really want people to understand what it is to be an operator today and to be helping people with psychedelic medicine today, where we can in legal jurisdictions using therapies available. So if you look at our news release today, we also highlighted there's 2 pretty big milestones, and we're proud of it. I mean, the credit goes to the practitioners, right, which I'm not. But our practitioners reached a milestone that we announced today, which was over 5,000 ketamine treatments and over 2,000 Spravato treatments. So a really big deal by anybody's standards in terms of, back to it, like who's doing the work today and are they helping people? And so, that's a bit of a long form answer to your question, but I really wanted to give a scope for where the demand is coming from, right? It's repeat clients, it's new clients. What kind of segments are we seeing that demand in? So you'll see in that news release, the Spravato segment within that 20,000 client visits is up over 400% year over year. So I can tell you that people are seeking out these alternative mental health modalities. My partner in business and now obviously close friend, Reed Robison, is very much a thought leader. I encourage people to look at our and the information we put out there. I started building this business 2 years ago, and he's devoted his life as a psychiatrist and a medical doctor to pursuing these alternatives for his clients. So we're not iterating here for the first time. He has a very good sense of these novel treatments, whether we're talking about things available today like ketamine, assisted psychotherapy, or Spravato, or the advent of what we're waiting for, which is the legalization of prescription MDMA first, and then psilocybin, where Reed is, as a leader in these trials, right, is very much trained and also practiced in terms of the iterations that have with clients on the protocols. So he's in a position to train our therapists and our team so that when these prescription medications come online, 2023, 2025, we really want to be well positioned insofar as that if we have that expertise from being involved in the clinical trial work, we expect and want to be a trusted partner insofar as that people will trust us, for that safe, as we said, medically supervised legal experience, which obviously, for depending on what vantage point you're coming at it from, I can tell you our patients and clients talk to us about it. And safety, I would say, is the number one priority, right? Beyond even efficacy, I would say for most people, depending on your own experience, your cultural vantage point, safety becomes the overriding theme. So, we're building something for scale to address everybody. There's a sort of an emotional aspect to that, but also an economic one. So you now look at groups that, depending on how we scale this offering, you don't want to marginalize those people for whom safety is first and foremost. You also don't want to marginalize certain economic groups that may not be able to access the treatments if they're only available at certain price points. So these become the themes that we're working out now, and it's less about allocating capital within a broader ecosystem, making passive investments like we were before. We're very busy, and it's not with that. It's with looking at how to scale the clinical research sites to advance the research and how to scale our clinics to enable access.
And I think to that point on safe experiences, there's a quote that I will often bring up when talking about this. I was listening to a podcast with Tim Ferriss and Sam Harris that they did maybe 6 months ago on the Tim Ferriss podcast. And they were talking about psychedelics and psychedelic experiences and basically saying, there's difficult or challenging experiences or there's really good experiences. But what I think Sam Harris is saying this specifically, what matters most is the experience safe or is it unsafe? Because if it's safe and it's challenging, that's still very beneficial to the overall healing trajectory. But if it's unsafe, then it could potentially be traumatic. People can't surrender. People can't sort of have the full feeling of it. So I think I love how that's front and center on your website. That's front and center in, your communication materials, that it needs to be legal and safe access to these medicines, because that's so critical to the efficacy of the actual healing, is that feeling of safety.
I appreciate you pointing it out, because it's something that we're working hard on. You don't want to preclude people. You don't want to marginalize people. Most people don't know that these alternatives exist in the first place. So, creating that on-ramp, for lack of a better word, of education and resources, we are, to make it another distinction, objective differentiation, we're a medical business, right? So sometimes we're compared with certain retreat operators or people that deliver this type of care in a different way, but we operate with teams led by psychiatrists and lead therapists at a master's level in some cases. So it's a very systematic approach. And while people like you and I, who are more experienced and very familiar also with the data in terms of efficacy and what it looks like to have a bad trip, right, in empirical data terms, our instinct, I think, is to say, no such thing as a bad trip, right? Only a challenging trip, and that can be efficacious as well. But that is something, that took, I think, whether we realize it or not, it took a lot of work and information and experience to get to that point, right? So people that aren't armed with that, not necessarily just psychedelic experience, but that life experience where, let's say, practices like mindfulness and more conventional psychotherapy, where people are ready to engage on a more spiritual or emotional level, is something that needs to be treated with great care when you're bringing people into that kind of vulnerable position. So, I think we're going a little bit down a black hole, but, another time maybe we can talk about it. I think it deserves a lot of attention. There's some people talking about it, not a lot of people. Ali Fiducia at Psychedelic Support has developed some resources that you'll see that look at, for example, people who are on some sort of SSRI regimen, for example, right, and have to wean off to have these experiences, which, again, these are things that you and I know a lot about, but for the newly initiated, there just aren't that many resources out there. So it's another part of the chain that we're focused on. I don't think enough people are talking about it in our space, and hopefully they will more so.
Well, and a bit of what you're getting at as well is sort of a philosophical shift in how we even approach healing. So much of healing over the past, we could say 30, 40 years has been much more, about numbing, so to say. So if you have anxiety, if you have depression, things as PTSD, typically you're given Prozac or Zoloft or Wellbutrin, something that sort of numbs the pain to get you back to what we would call sort of a base level where things just feel fine. And, a couple years ago, Robin Carhart Harris published a groundbreaking research paper out of Imperial showing those differences between typical antidepressants, which activate the 5-HT1A receptor, and classic psychedelics, which activate the 5-HT2A receptor. And sort of the difference that he showed is the reason psychedelics were showing a lot more efficacy in terms of treating depression or addiction or anxiety is because it helped clients to go deeper into the pain, almost like a catharsis, feel the full pain, and then move through it to fully heal it. And sort of moving through that and allowing that trauma to be processed comes back to the safe container, because if someone doesn't feel safe, then they can't surrender to those traumatic experiences, which is often sort of the underbelly of depression, anxiety, addiction, etc., things like that. So I think what you're speaking to as well is a whole sort of paradigm shift from a client perspective, where people are so used to just saying, hey, there's a pill, this will help numb you, right? You don't need to deal with your issues, it's just a Band-Aid. And what psychedelics do is they say, hey, it might be difficult at first, it might be challenging, it might take some courage, but if you sort of, as Hunter S. Thompson said, if you buy the ticket, you take the ride. And so if you're buying the ticket, you're taking the ride, you're going down that path. People need to feel like, okay, I feel held, I feel safe, and I can fully surrender to this. Understanding that on the outset beyond that is a sense of peace, a sense of equanimity, a sense of more balance.
I think people kind of lose track, actually. I basically, I concur with everything you said, and what it made me think is that people lose track because of how quickly things have moved, particularly in the last couple of years. But what we're doing is unprecedented. I mean, I deal with it every day because I'm building a business which requires me to create and execute a model that people are going to interact with, right? We're helping people. These are not widgets. We're dealing with minds and people and lives. And it's a very, very sensitive business to be in, okay? And I would argue that what we're doing is unprecedented, which means that the paradigm shift that you described from take a pill for your ills, take one every day, take one every month, whatever it is, the paradigm shift from that to I'm going to have these experiences are going to be integrated, I'm going to be forced to go down a couple layers. It's totally unprecedented in terms of what people are used to interacting with. And that's a bit of a bottleneck.
That's where the fun is too, to create that challenge is probably what is so exciting for you as a CEO. Is it's a really novel challenge to have to sort this out, and put this together in a way.
Totally. I mean, I love it. And it's not just the mechanics of it, right? It's the reframing of it, because to add to what we were just describing as a new paradigm, you're talking about curative outcomes in the best case scenarios, right? Again, totally unprecedented. I mean, we have a lot of things, amazing things in the world in January 2021, but, curative effects for mental health, when you compare oncology or cardiology and you look at the advances that they've made over decades and the tools that are working and the data that shows that rates of incidence are going down or the people suffering from disease are getting better care, you just don't have that in mental health. And that's widely understood. That's not my original thinking. That's every psychiatrist that's been practicing for the last 20 or 40 years, and we're working with a lot of them. So, to reinvent the world a little bit, it's absolutely exciting. I love it. I love the mechanics of it, and I love the sort of the strategy and the more esoteric side that we're talking about now is how to frame this in a way that people will be comfortable and that the infrastructure that we build, matches what they need. Because that'll evolve as well, right? Our great grandchildren will be visiting very different clinics. So again, to focus on the positive, I'd say the big win for people like you, people like me, people involved in moving the space forward is that, and like I said before, I think everyone will agree, anyone in our position, that the stigma is starting to soften for sure, right? And that's the big win, that, podcasts like yours, businesses like mine, things like the Third Wave, these are the resources, the information. You're basically empowering people, right? You're taking the intimidation factor away by empowering people with knowledge. In our case, making these experiences accessible, again, in that medical trusted model where people can actually open up to the type of experiences you were describing and open their mind to that type of healing precisely because that layer of safety and trust is there. There's no way you're going to get those outcomes if people aren't first made to feel safe.
Absolutely. And sort of to go back into brass tacks a little bit around safety, around what you're developing with Novamind. We've talked about the clinic, we've talked about synthesis, the psilocybin retreats, the other retreat in Costa Rica. There's
a lot going on there.
There's a lot, yeah. But and my point being, a lot of it is on the physical space. Like these are the places that people can come and access them. And so one thing that I wanted to ask you about was drug development. Because so much of what we're seeing right now in the psychedelic space is, I don't need to name the specific companies, but, company X is trying to patent psilocybin for treatment-resistant depression. Company Y is trying to patent this other sort of delivery method for psilocybin for major depressive disorder. Companies, I just saw this thing the other day on Twitter, like there's a company that's opening something called the Cybrary, where they're trying to patent 1.2 million psychedelic molecules or, something ridiculous and absurd like that, which is so cool. It's kind of like the Sasha Shulgin thing, exponentially elevated. But it sort of brings home a point that I've given a lot of consideration to, which one of the fundamental shifts with the psychedelic space is less of a focus on the product, if you will, the pill, and much more of a focus on the container, on the set and setting, on the legal, safe environment that needs to be set up for these experiences. So just from a CEO perspective, why did you choose to focus less on the drug development element and much more on the physical infrastructure, the physical spaces, and sort of what's legal and available now, rather than, even someone like Field Trip, for example, who you're an investor in, is developing the FT104 molecule. So I'd just like to hear your thoughts on drug development, why Novamind is not focusing on that, and what that says about your vision of the future for psychedelics.
Wow, a lot there. I'm happy, first of all, for you to shine the light on it and for me to answer it, because the environment you described is, as you can imagine, we're investors and operators in the space. We see exactly what you do. Of these, I think dozens of drug development companies are now turning to maybe hundreds of drug development companies, right, or purported drug development companies, developing libraries. The Sasha Shulgin reference was good, but note that none of these companies appear to be, focused on bringing us the next Pical or Tikal. They're
Right.
really,
Yeah.
there's a 21st century, commercial model there to build big walls of IP as quickly as possible, and to kind of replicate that model of selling pills, right, in a very lucrative way for a long time, 20 years or whatever the patent laws will give you. So that's context. That's what, for you and me and all the listeners, that's what you're talking about when you say, when you shine this light and you say, look at all the drug development wave of capital as well that's going in there. And so what first of all, why aren't you doing it? And what is your relation to that? So it's an insightful question. It has a lot, we think about these things all damn day. And so here's what we think about them. We are not drug developers, right? Without a doubt, we do not develop drugs. We're not interested in the business model associated with it, which is a biotech model that I'm very familiar with and have invested in, but is not one that as a business builder I want to pursue. And it involves investing hundreds of millions of dollars over a period of 5 to 10 years to take something through the clinical phase trial process for a potentially very successful outcome. But it's a very high risk, very high reward, and very capital intensive business model. And that's why from day one, when we chose to enter the space, we chose not to enter it in that way. However, we do very much want to be both contributing and involved in the advancing of the research, to be specific, the advancing of clinical trials and research studies, some preclinical, that will bring novel therapies to market. Bottom line, we want to support that in every which way we can. So the way we do that, both as on a contribution level as far as participating to the space, and as a business that wants to succeed and build profitably in the space, all of that energy and thought, and there's a lot of it from our perspective, is focused on our CRO. CRO is an acronym, for those who aren't familiar. It's Contract Research Organization, and it defines basically an entity that serves, I mentioned before, pharmaceutical companies, not-for-profit, academic institutions. Those are the clients of Cedar Clinical Research, which is the name of our clinical research platform. And those clients will come to us for phase development in the clinical trial process. So in some cases, that means designing studies, recruiting patients, executing those studies, collecting the data, and reporting on the data. In other cases, large pharmaceutical clients that we work with some of the world's largest, will have thousands of trial sites, of which we were one or a couple. They will have a design trial that is at a later phase, which is why you would have thousands of sites. They will come to us, we will recruit patients, and we will execute the trials. An example of those would be Reed Robinson's work with Spravato. So he led the clinical trials in Utah for Janssen for Spravato. I mentioned earlier that we've, through the Cedar Psychiatry network of health clinics, have administered over 2,000 doses, and that's industry leading. There's very few individuals or clinic groups that have had that kind of experience. And again, I tell the story so that you and your listeners can understand the connection, that when you have the very unique thought leader like Reed Robinson, who is both as a researcher advancing the trials to bring these novel therapies to market, and is also a clinician who's then able to provide his clients with alternatives, very powerful combination. So that connection between clinical research and our clinics that I just described with Spravato, we expect the same with MDMA, and we expect the same with psilocybin. This is very different from being a drug developer per se. We're happy. We're, first of all, drug agnostic. We're company agnostic. We want to help as many people as we can by providing our expertise, which I can get into in some detail, but I don't know how much time we have to go down all these rabbit holes. But I'll make the long story short on this one. If you're a clinical trialist like Reid Robison or others with expertise and have done many clinical trials, you quickly understand that a clinical trial site in psychedelic medicine is very different from an average clinical trial. So you can appreciate if you're dealing in trips of 4, 6, 8+ hours in length, you've got a protocol that requires 2 therapists, you've got certain set and setting, if not requirements, then goals. This is very specialized work in the clinical research business. So we're really good at it. Reid has built a team and an organization around it. And part of what our growth plan is to expand clinical trial sites so that when these drug developers, and hopefully the ones that fall into the category per our earlier conversation of serious people who have a good shot at bringing these things through the various phases, which takes a long time and a lot of money, we do want to support them. So that's our interaction with drug developers, the traditional drug developers. It's also, I'll mention, it is, in terms of margins, it's a very lucrative business. So if you add a lot of trials and a lot of sites, it's much more profitable, in fact, on a margin basis. So that business could be very big for us. And the last thing I wanted to share sort of on this particular subject of drug development in the context of CCR is that what we do currently and we expect to do more of, we'll be talking more about this in the future, is the development of therapeutic protocols. So different from drug development, in the case, I'll use a working example. We've started in our lab, and if, again, you look at our website or our press releases or our deck, our corporate deck is available on our website, it goes into some detail about this. And we've been working at Cedar Clinical Research on something called FCAP. And FCAP is an acronym for Emotion-Focused and Ketamine-Assisted Psychotherapy. And it's a hybrid. Emotion-focused therapy is a particular modality, and there's a thought leader in that space. Her name is Adele LaFrance, Dr. Adele LaFrance, who's a PhD psychologist who's one of our consulting research scientists. Her expertise in emotion-focused therapy, combined with Reid Robison's expertise in CAP, ketamine-assisted psychotherapy, have been put together in a therapeutic protocol to address clients that are suffering with anorexia as well as MDD. There's 2 different protocols. But what we've done is we've taken ketamine, which is a compound that many people are very familiar with and we have a lot of experience with, obviously, and we've paired it with a very particular therapeutic protocol, and we've recruited patients and we've collected data, and we'll be reporting on the efficacy of that protocol. So that example gives you a working example of the type of therapeutic protocol development that we're able to do in-house, and that we are positioning ourselves. If you look at, for example, our scientific advisory board, you'll see there's some real exceptional domain expertise there in things like palliative care. Dr. Craig Blinderman, who runs palliative at Columbia in New York, has, the opportunities. I'm not going to go through the SAB, but using that example is that we can now take an indication, whether it's palliative, like I just mentioned, or the eating disorders trial that we're working with now with FCAP. And we can attach those to different compounds, and we can develop those therapeutic protocols, find out if they're efficacious, and if they are, disseminate those to other people, right? So our goal is to play a certain place in the, let's call it the value chain, where our goal is, in fact, to spread this knowledge as far and wide as we can. And we're not a not-for-profit, let me be clear about that, but our model is more akin to MAPS than it is in that respect to some of our other peers, where we believe that the priority is to create that network effect. As you can imagine, if our therapeutic protocols are working in eating disorders, where Reid Robison and some of our other team, Adele LaFrance I mentioned, are world experts, then why wouldn't we want to disseminate that to all the eating disorder centers that exist all over the world looking for alternatives, right? So a couple of sort of very specific examples for you and your audience that you don't have to be a drug developer to bring therapeutic protocols to market. And we're going to do that. We're doing it in real time. We don't have to go to a clinical research organization to do that work for us. We can do it in-house, and we can do it very cost effectively. So not a drug developer, but a developer of therapeutic protocols for sure. Our involvement in the MDMA trial, obviously with MAPS, and we're looking to involve ourselves also with some very specific late-stage work with psilocybin.
Mhm.
It means that we are happy to rely on the leaders like whether it be Usona or Compass with psilocybin or MAPS and others with MDMA. They are doing the very hard, very expensive work of proving the safety and efficacy data and profile of those compounds. And we're grateful for it, and we're following their lead and building on their shoulders. We're not going to go into the lab and develop new drugs on the classics or the others. We're going to let them do that work on safety and efficacy, and we're going to wrap, therapeutic protocols around those compounds. And that's how you help people now.
That speaks to a couple points which I want to highlight. One, you mentioned Usona and Compass. Those two companies in themselves have an interesting relationship because Compass has had a couple big press releases around psilocybin synthesis, and then Usona will sort of come out as a nonprofit and be like, hey, we just open source the psilocybin synthesis. Here it is for everyone to see. So I think there's an interesting dynamic, particularly in the North American psychedelic landscape with MAPS and Usona, who are essentially saying, hey, we're at the forefront of this. We're nonprofits. I mean, MAPS has a public benefit arm, but all of those profits go back into the nonprofit. And we're leading with MDMA for PTSD and psilocybin for, major depressive disorder is what Usona is focusing on. And Usona is also now applying psilocybin to other companies in the space that need it for clinical trials. And what you're speaking to, which I think is much more sort of the future of psychedelic medicine, is, hey, instead of creating IP around drug development, let's create IP around the treatment protocols, the way that we actually use the drug, because that will actually be much more valuable in the mid to long term as the methodology that's used, the container that's created, actually matters a lot more than the specific substance. And the reason for that, and again, I'm thinking more long term, 10 to 20 years, not the next 3 to 5 years.
Sure.
The specific substances that come out, there will be psilocybin, or there will be other, 4-ACO-DMT, which is another psilocybin analog.
Yep.
There's going to be thousands of these analogs that have very sort of similar approaches, just slightly nuanced. And what's going to matter a lot more is the efficacy of the container, the way that preparation is done, the way that the experience is held, the way that integration is carried out. And so that's what I hear you speaking to about sort of the future of Novamind is, okay, you're really looking at specific to eating disorders, specific to MDD. You're probably going to look at addiction and alcoholism, maybe PTSD. Like, what is that 1 month or 6 month or year-long trajectory that clients are going through to ensure that the underlying cause is healed, that it's curative, as we talked about earlier. And it's not just, we'll give them a drug and they'll come back 3 months later, or we'll give them and they'll come back a month later. It's really about, okay, how do we address the underlying cause by developing these incredibly efficacious and innovative treatment protocols?
Holy shit, there's a lot to talk about here. I'll try and be succinct though. So, I mean, no, I appreciate that you're, we're sort of picking at the layers here. So let me first say, that first sort of comment, insofar as when you look at the environment and what's going on, and we're in a world where not-for-profit entities have spent $100 million over 30 years taking an off-patent molecule, right, through a phase 3 process with the FDA. This is the world we're living in. That on its own is fascinating. Then watching the interplay with for-profit entities operating a similar model, let's again point out that these organizations are all run by very thoughtful, very experienced people who have, similar to us and other people in the space, have agendas that are both altruistic and economic, right? So, just to say that watching that go on is fascinating. I haven't figured out exactly how it's going to work, and that's why I think it's not bullshit when people in our space talk about a new paradigm and unprecedented models for doing business and for medical care. That's my first take on it. The second one is really that, our approach is a very specific approach. So it can be differentiated from certain of our peers. And certain parts of our approach, I think, they portend for the future. The decisions we're making today, I think, portend very specifically for the future of Novamind. So what I mean is that when I mentioned earlier a couple times that we're drug agnostic, right? Or we're drug developer agnostic. That approach, that mantra really permeates our whole organization, because rather than believing that we will come up with, whether it's a drug, a therapeutic, whatever it is, this sole source of care, right, that is going to be a perfect fit for everybody. This is the antithesis of our model, let's say. We take a view that what you really want, if you're going to be the infrastructure or the access point, make it a little intimidating, where people are seeking out these alternatives, you want to find the modalities that are right for them. Right? So ketamine is the first legal psychedelic, but it's not appropriate for everybody. Right? So why create a system where that single source starts to define, where you're essentially not forcing, but pushing or creating the paradigm where few or only one alternative exists for that person? Rather, if you go into one of our outpatient mental health clinics today, and certainly in the future, that today you'll see a spectrum. It starts with CBT and prescription management, and there's a nutritionist and things that are, I'll say, are typical services in the outpatient mental health clinic. And then the non-typical stuff is why we're building Cedar Psychiatry into what we think will be, one of the leaders. It's because they have for years now provided the spectrum of alternative mental health modalities, things like CAP, or ketamine-assisted psychotherapy, like we've talked about, things like Spravato, which we've also talked about, TMS, transcranial magnetic stimulation. These are the spectrum of alternative services available today in our clinics, and that you won't find at a lot of other clinics because the reasons we've talked about, because it by definition, it's the people who adopted them early, right, in the last 5-10 years, and now are practiced and have the ability to bring it to clients. So it really is a matter of objective differentiation. It's not being all things to all people, but we want to match on a compound level or on a protocol level the right treatments to the right people. So that's the model for operating clinics, and it's also the model for the clinical research aspect of our business, which is that why would we preclude someone from, let's use your example, synthetic psilocybin, right? You're going to have a Compass version, you're going to have a Usona version, you're going to have a model of delivery with Compass, you're going to have a model of delivery with Usona and with others probably. Mm-hmm. So rather than necessarily pick and choose per se, and maybe it'll come down to that, and maybe we will need to, and I'm open to everything because this is a very evolving space. But, our preference, right, would be to offer all the alternatives to as many people as possible, because our experience so far, I can tell you, spending a lot of time, obviously, with Reid as a researcher and clinician, and on the clinical research projects we're involved with, I can tell you definitively that not all compounds are all things to all people, right? PTSD sufferers are going to get an incredible novel alternative very soon, I hope, but it's not going to be a panacea. Okay, on those curative rates, the data that you and I have been excited about for years, and that what people get an understanding of today, and they see that, that first, I think, what was it, 76% was the number in terms of like right, that they didn't meet the
after a year, I think
the numbers really, just to be clear. Yeah, exactly. What Paul and I are talking about, it's like this well-known study that came out early, that after a year of that MDMA PTSD protocol treatment and integration, 70+% of those people no longer met the requirements for their PTSD diagnosis. So it's profound stuff, but let's not forget about that 24-25%. It's just going to be a lot of work and a lot of iteration. I think the hope is that a couple decades from now, it's like we're going to look back on this, and stigma is going to be gone, and we'll be able to match people with the treatments that they need, and they won't suffer unnecessarily for decades, which is the case with, again, let's just bring some light and some humanity to the data points. People love talking about the WHO number, which is 300 million people suffer from depression. I don't know if they've updated that stat, but that's the one that a lot of people use. Well, 30% of those people are treatment resistant. Okay, so on that 300 million base, that means hopefully about 200 million people are more or less served by the current standard of care. They can get out of bed, they can go to their jobs, they can love their families. And there's 100 million people that are not responding to the standard of care. Right? So the message from me, from us, from Novamind is, let's create, it's not just an industry, but a world where it's a spectrum. continually that spectrum that I talk about, and where we're helping as many people within that spectrum. Obviously, there's priorities in terms of how new industries are created, and that's why MDMA for PTSD as an indication, comes first. And I think there's economic and political reasons that drive that too. So bit by bit, that's how we get to healing the most people.
And something that I picked up on in that response was sort of this personalized approach, which I think is so critical. And ideally in a future, let's say 5 to 7 to 10 years from now, we'll be able to, maybe using big data, maybe using AI, maybe using whatever else, there will hopefully be an ability for every individual, whether they suffer from PTSD or, treatment-resistant depression or alcoholism or anxiety, or something we haven't even talked about in this conversation, but is also relevant to those who are looking and working with psychedelics. There's a lot of folks who use them for creativity, for purpose, for innovation, for, that whole spectrum, which we won't get into now because I know no focus so much on that.
I just want to we're covering pretty much everything. So it's we focus this conversation on Novamind's model for healing the sick for the most part, right? We really haven't focused it on the bettering the well part, and that is definitely a part of the world. But our focus now is helping people that really need the help, for sure. And all manner of people. And that's why, going into our clinics today isn't quite so intimidating, because it might not be a high dose or low dose psychedelic experience, right? That might not be the fit for you. So yeah, you brought up the data aspect as well. Like when you get into the potential to use that data, the quantified self, then we're also talking in the realm of preventative, right? Versus therapeutic fixes. So imagine now that people who are predisposed to these diseases have tools that are available on a consumer level to sort of preempt them to avoiding the outcomes that to us are like, oh, fuck, you're depressed? Oh, sucks to be you, right? That's normal now. That's like a normal thing. So maybe we avoid those outcomes altogether in a future that's driven by data, but that's a whole nother podcast.
It's a whole other podcast, yeah, because that gets quite complex. Well, we're nearing the end of the hour, so I just have one last question for you, and take this as you will. It's a bit of a sort of, again, a forward-thinking question that particularly has been brought about by COVID. The way that we think about the future of the clinic is changing before our eyes. And sort of context for this, a company that we have partnered with at Third Wave is Mindbloom. And Mindbloom, in early 2020, late 2019, they had opened up a physical ketamine clinic in New York, where they were starting to do in-person ketamine treatments with lozenges. And then when COVID hit in mid-March, they pivoted as a company and they got rid of the physical space in New York and focused only on telemedicine ketamine therapy. And recently, right, I've gone through that. I live in Florida, so I can legally get ketamine sent to my home and basically set up my own environment, my own setting at my apartment in Miami, where I put on, a playlist. I put on this thing called the Apollo Neuro device, which uses vibrational touch to help with nervous system regulation. I laid back on a Shakti mat, which is like an acupressure mat that you can lay back on. And then I did about 300 milligrams of ketamine in lozenge form, and sort of went through this Mindbloom experience. And essentially, a couple weeks after that, I met Dylan, who is the founder of Mindbloom. We got together in Miami and was just telling him, essentially what you're building is sort of the clinic of the future, where instead of a person going in physically to a clinic to get an IV ketamine or to get a Spravato treatment, can actually get ketamine sent to their home. The practitioner can come to their home, and their home can sort of act as this pseudo clinic in a way. So I just wanted to sort of hear your thoughts on the future of clinics and how you see that relationship developing between going into an in-person clinic and, this telemedicine approach in psychedelics, which I think will become much more prevalent in the next 2 to 3 to 4 to 5 years, even with things like psilocybin and MDMA. How do you see sort of that balance, that relationship, that development?
I'm more open than one might think to novel approaches, particularly when it comes to client access. Right, because there's a bottleneck, and it's between the stigma, the lack of resources. There's a lot of reasons that truly it's a bottleneck that stand in the way of people accessing help. So in that context, I'm very open to innovation and novel models of delivery, and Mindbloom, as you mentioned in some detail, is doing that, So I see the benefit insofar as innovation. There's a very direct line I can draw to helping more people. With that said, we are a medical business that is really built and predicated on a certain standard of care. And I don't mean that in a pejorative way in terms of comparing us to other people, but in a well understood way, which is that people expect a certain standard of care in places like North America and Europe, et cetera, when they interact with the medical system. So today, that model that you described, as innovative as it is, it really doesn't fit what people look to us for.
Mm-hmm.
I'll add to my thought on that, if you take, for example, inspiration from someone like Rick Doblin, which we all do, anybody who's building anything in this space owes enormous debt of gratitude to Rick as an individual, to MAPS as an organization. And so even though we're very much a for-profit and very different type of entity, like a lot of people, we take a lot of cues from what Rick thinks, from what Rick says, and from what Rick sees when people ask him what you're asking me. Hey, look into your crystal ball, right? So if you listen very carefully to what Rick sees in his crystal ball, he's been saying for a long time that his worldview, I remember this very specifically, it's more likely that in a couple of decades from now, many of these experiences are facilitated by guides in the form of brothers, best friends, cousins, sisters. So, it's really not hard to imagine particularly when I mentioned that it came from Rick Doblin's brain, that world existing, right? So if you're going to go through a difficult, vulnerable experience and go cry on someone's shoulder, it's going to be that best friend, brother, sister, cousin, whatever the hell it is. Mm-hmm. So why not in the context of what we're talking about, right? So I see that world. I see the world that you're describing with innovative models, sort of where people are tapping into self-care on their own. Mm-hmm. But the reality is that on a base of 7 billion on the planet, and whatever percentage of those that are going to want these experiences to improve their quality of life, the vast majority are not going to fit into that category. That's what we talked about before. It's really easy for people like us to curate businesses for people like us. Mm-hmm. Okay? It's way harder to do it for the other 80%. I'm open to it all. I think that in terms of treating people, Novamind does not operate from a position of scarcity. Rick as well has said, and he's definitely a godfather in that way to the industry, because people should listen to what he says. He's been at it a very long time, and he's incredibly thoughtful about it. So he has described in explicit terms that if psychedelic medicine is going to come back into our world and exist in a regulated way, it's going to require thousands and thousands of clinics and an army of trained therapists, right? So that's why I say we don't deal from a position of scarcity, and I don't need to respond to your question by saying we're right and they're wrong. We've invested in some of our peers, right? I mentioned that at the top. I have a lot of respect for a lot of the people building things in this space, and I'd like to see many of them succeed insofar as they're providing, a certain access to certain groups and pushing the world forward. I happen to believe that with our model and with the start that we had, because we're not, creating this model from zero, we're building on what Reed Robinson built for the last 5 years, particularly with the Cedar clinics. That will be one of the, I like to say that we'll be one of the top 5 players in the clinic space, right? So if it's a world where thousands and thousands, first of all, the regulated policy environment exists and the rules are established and the parameters of how people interact with these drugs and the practitioners, the experience. Once all that is understood, there's no reason why we shouldn't be a leader in those thousands and thousands of clinics. Many of them should be ours.
Yeah, and it's really about the both and, it is this sort of blue ocean. There's so much opportunity and possibility, and what you're speaking to is a very collaborative approach, which is why you've invested in Field Trip and Synthesis and Atai, why you have Cedar, and why you're creating the standard of care that you're creating. Because I think to hold that bar, especially as an influential early player in the space, which Novamind is, to hold that bar of the standard of quality of care that's required, I think, is essential to ensuring that this movement is as successful as people hope that it will be.
Yeah, it's a big responsibility, in fact, because if we screw it up, it's not going to be good for us. It's not going to be good for the sector. So we've asked for the responsibility.
Right.
We've gone public now. We've been publicly traded now for a few weeks, 3 weeks, and we were really under the radar for the most part. I mean, you were aware of us. You're familiar with some of the investments we made, et cetera, et cetera. But for the most part, in terms of raising capital and those things, that's all our own networks. And me and my partners have been building businesses with this model for a long time. So we're kind of having our coming out party now, and we want to talk. I want to have as many of these conversations as possible for exactly the reasons that what we've covered, where it's the operating models for psychedelic medicine are not well understood and are not clear. We have one today that's working. We want to put it out there. We want to make sure people understand it. It'll change. It'll evolve, but that's kind of the point.
Well, great. Well, thanks so much for coming on and sharing everything about Novamind. It was, we met about a year ago now. And so I've been, aware and plugged in, but it's so cool to experience and just hear more about how it's developing and how the vision is developing and, everything. So I just appreciate you coming on Third Waves podcast and sharing more about this. It's really, really appreciated.
This was a good time. Thanks for having me, Paul. Thank you, everybody.
Cool. Thanks, everyone. Bye, Yaron.
Take care.
See ya.
Bye.